Good morning and welcome to Florida International University and the State of the World 2021. I'm David Kramer. I'll be your MC for the entire week. It's a privilege to be here with all of you this morning for this, our fourth annual State of the World Conference on Global Relations and U.S. Foreign Policy. In a very short time, State of the World at FIU has made its mark on the major global affairs conference circuit by being the first one of the year and a must-attend event. It is the signature event of the Dorothea Green Lecture Series, so generously endowed by Ambassador Stephen J. Green, his wife Dorothea Green, daughter Kimberly Green, and the Green Family Foundation. We are so grateful for their continued support. State of the World is also the first conference of its kind in Miami, and a milestone for the Green School each year, bringing dozens of the nation's leading experts in foreign policy and global affairs, from ambassadors and heads of state to current and former advisors to Presidents Trump, Obama, Clinton, Bush, and Reagan. Organizing a conference like this is a huge undertaking in any year. Doing so remotely during a pandemic presented a different sort of challenge. We were determined not to let anything get in the way of our mission to bring the best to FIU and for the world to see the best of FIU. I want to thank all of my colleagues who have participated in putting this conference together, and I'm very grateful for them and will acknowledge them later in the conference. This conference is different than most of the others in one very important respect. It is centered at a public university. And while our audience this year comes from around the world thanks to Zoom, we do this conference for our students. It is an opportunity for them to hear from some of the leading minds, scholars, policymakers, and activists from around the world. And just as importantly, it is an opportunity for us to showcase our amazing students whose questions every year nearly steal the show. We are tremendously proud of our students here at FIU, and this conference helps us show off our impressive talent. We are proud once again to partner this year with the McCain Institute, part of Arizona State University. And we want to thank Cindy McCain and Executive Director Mark Green for their continued collaboration, support, and partnership. I also want to acknowledge the generous support of Andrew Duncan and Charles Davidson in helping us make this conference possible. And now it is my pleasure and privilege to introduce to you the fifth president of Florida International University, Mark B. Rosenberg.
David, thank you so much. Good morning, everyone. Thank you for being with us at FIU. We are thrilled to be able to share with you these important views on the issues of the day, particularly in this instance, the struggle for democracy. So I want to paraphrase, if you'll allow me, an earlier summary made by someone who was on the world stage decades ago. There are years when decades happen. We are in one of those moments now. No question that this global pandemic has accelerated the future in very stark ways. Here, we're gathered to discuss the viability of democracy, not just globally or regionally, but right here in our own country. Look, we've become accustomed to a focus on democracy's viability elsewhere, but rarely have we had the opportunity or the necessity to discuss our current situation using the same viability frame as we've used to explore democracy's viability elsewhere. There are actually multiple reasons driving the rapid change that we are living, oscillating between past, present, and future, between hope and opportunity, and risk and threat. And we're going to discuss many of them over the next 3 days. I would like you to know, however, that at FIU, we are pleased to share this platform with you. It is said that universities are communities of memory and hope. Unlike many of our higher education counterparts, we're a university that really does not have a past. You see, we were opened less than 50 years ago, so we do not drag a lot of the historical baggage that may predetermine our mindset here at FIU. Our students largely come out of direct experiences of migration, dislocation, tyranny, poverty, difficulty. They're very competitive in the world of work, with one foot in analog and another in digital. We easily have one of the most diverse honors colleges anywhere in the world. A very large number of our students are first generation to attend college, and 85% work full or part-time and are dependent on some form of assistance, largely Pell Grants. Miami itself as a community is certainly far from formed. We're not post-industrial like many of our cities, because heck, we had no industry to speak of. We believe that this actually gives us an advantage as we face forward into this 21st century. Gotta fix the camera, here we go. We've had some advantages. A global outlook of urgency nested in highly competitive teaching, learning, and research in a transnational city that continues to redefine itself, most recently as a fast-rising arts, tech, and innovation center. Another advantage, a solutions orientation that demands practical approaches to addressing issues like sustainability, water quality, health disparities, and the rule of law. A majority minority student community, over 58,000 students, that has an unprecedented 4-year graduation rate. National leadership in graduating minorities in engineering and computer science, addressing sharp national needs for diversity and talent that every day need more and more attention, as we have seen with the recent events concerning George Floyd and others. And we have a tradition of state legislative support that has enabled us to become a top 50 public university with unprecedented graduation rates for our urban-based minority student population. So we have some advantages that we're plainly very excited about. And another advantage is the Stephen J. Green School of International and Public Affairs. The Green School, in short order, has become one of the largest and the most diverse international and public affairs schools in the United States. The Green School is led by founding Dean John Francis Stack, who you'll meet shortly, himself a graduate of the Joseph Corbell School of International Studies at the University of Denver. And the school offers an unprecedented 37 degree programs, nearly 50 certificate programs, and we host in the school one of the country's top model United Nations programs, which is consistently ranked in the top 5 in North America. So you see, this State of the World Conference fits perfectly in with the Green School's mission. This week, we're going to have timely discussions with leading experts, as David has said, on some of the most pressing issues. We got a packed agenda. We want to thank Arizona State University and the McCain Institute in Washington, D.C. for partnering with us. And to our panelists, thank you so much. We appreciate that you are taking time to join us and to help us raise our level of understanding about the challenges that we confront today and into the future. I look forward to the conversations over the course of this week. And just like there are years that decades happen, let's make years into words spoken these days. And now let me turn the microphone back to David Kramer.
President Rosenberg, thanks so much. We're grateful for all you do and the leadership you provide to all of us here at the university. Thank you for being here with us this morning. I also do want to acknowledge the founding dean of the Stephen J. Green School of International and Public Affairs, John F. Stack Jr., who had some technical difficulties earlier, but Dean Stack has really been the rock that has provided the foundation for the Green School, and we're enormously grateful for everything he has done throughout his 4-decade career here at FIU, but in particular his leadership of the Green School. So Dean Stack, thanks so much for joining us as well, and we'll come back to you later in the program. Let me just lay out a few housekeeping rules and provide some guidance to all of our listeners, and we're grateful to all of you for joining. As President Rosenberg said, we have 5 full days of panels and conversations, and please join us for any and all throughout the week. The same login you received for right now will also work for you during the rest of the week or later in the day, should you have to leave us at some point today. Toward the end of each session, we will be turning to questions from the audience. And we ask that you use the Q&A function. I think we're all accustomed to that now after this nearly year of Zoom. Send questions in through the Q&A function at the bottom of your screen, and we will do our best to get your question before the panel. And because we want to give priority to our students, our FIU students, we ask our students to indicate at the very beginning of their question that they are an FIU student, and then we'll do our best to put you a little ahead of the queue of some others, but we'll try to get to everyone's question to the best we can. You all should have a program, and I think one of my colleagues is going to post the link to the program. This means that we don't need to give extensive introductions to all of our panelists and moderators. You can find their bios in the program as hopefully you all have received. So let's get started with our opening panel on an issue that has dominated our lives for the past year. And that, of course, is the coronavirus pandemic. We have a terrific panel featuring some of FIU's finest talent. And our moderator for this session will be Dr. Aneta Roldan, who is the CEO of the FIU Healthcare Network and an Associate Dean for International Affairs at the Herbert Wertheim College of Medicine here at FIU, an immediate past CEO and president for the Jackson Health System in Miami. Dr. Roldan, we know it's been an incredibly busy time for you and the panelists. We're grateful that all four of you could join us. Over to you, please.
Yes. Good morning, David. Excuse me. Good morning, David, and thank you. Thank you so much for that kind introduction. It is truly a pleasure and a privilege to serve as the moderator for this panel, covering such an important topic that has impacted lives and economies globally. Just over a year ago, the world shook in the face of a novel virus. In a short amount of time, countries around the world were being faced with a high toll of morbidity and mortality, and the global pandemic showed its ugly face. As of today, February 1st, there has been approximately over 103 million cases and over 2.2 million deaths. And just in the US, we have seen over 26 million cases and over 440,000 deaths. An impact too great to measure, with thousands of families that have been impacted in more ways than one. The burden of morbidity, mortality, and socioeconomic impact is exponential. And yet we have only just begun to feel the aftermath of what is to come. Many advances in diagnostic therapeutics and now in vaccines have been accomplished. However, we are still facing many unknowns. More has to be done to shun the face of this pandemic, especially in vulnerable populations across the globe. Today is my true honor to welcome as this morning's panelists, three extraordinary colleagues to discuss the global, national, and local impact of COVID-19 pandemic. Each is an expert and highly dedicated professional in their respective fields. I am proud to serve along with them as we continue to face the many unknowns of COVID-19. Their brief introduction do not do justice to their extensive contributions they have made in healthcare and in public health. So I shall begin to introduce Dr. Cheryl Holder. Dr. Holder is a fellow of the American College of Physicians, has dedicated her medical career to serving the underserved population. She has served as the National Health Service Corps Scholar, medical director of one of Miami's largest community health centers, and participated in NIH and CDC health advisory and programmatic review update panels. Dr. Holder focuses on teaching the impact of social determinants of health, on health outcomes, addressing diversity in health professions through pipeline programs, increasing awareness of HIV prevention and health impact of climate change. Next is our own Dr. Eileen Marty. Dr. Eileen Marty is a distinguished professor of infectious disease, Department of Translational Medicine, Herbert Wertheim College of Medicine. She is a physician scientist with decades of clinical and research experience. She has more than 40 years of research experience and with heavy contributions to study on the pathogenesis of Ebola virus on non-human primates, disease surveillance, and the public health impact of disease, including legal, medical, and sociological factors. Dr. Marty served on multiple national, regional, and international boards, helping the World Health Organization with mass gathering medicine and with the health security interface, working for the United Nations as a weapons inspector and working at the White House for the National Security Council and as a presidential advisor. Last but not least is Dr. Mary Jo Trepka. Dr. Trepka is a professor and the chair of the Department of Epidemiology at the Robert Stempel College of Public Health and Social Work at FIU. She is an infectious disease epidemiologist who focuses on the role of social determinants of health in disparities in HIV/AIDS and infectious infectious diseases. In 2011, she received the 2010 Presidential Early Career Award for Science and Engineering from President Barack Obama for her work analyzing the role of poverty, segregation, rural-urban status, and racial disparities in HIV survival. Currently, Dr. Trepka is also leading a study about the influence of the COVID-19 pandemic on people living with HIV. Trained by the CDC's Epidemic Intelligence Service, she has led surveillance and disease control efforts at both the state and local levels. I think you would agree that today's panelists are highly experts in their field and, more importantly, compassionate physicians and passionate about what they do. We will begin with Dr. Marty. Dr. Marty, welcome. Good morning. Thank you for being here this morning.
Good morning.
Dr. Marty, why did the SARS-CoV-2 become a pandemic in our world? If you would like to show the first slides, please.
Yes, please. Thank you. Okay, let's move on to the next slide. Let's try and get an understanding of, oh, this is not my slides. I'm sorry. Let's just talk then, because you don't have the correct slides up. Let's talk about what your specific question is. When did it become a pandemic? Well, it became a pandemic because it became a pandemic as soon as there were cases happening in multiple continents. That's the definition. So really, it became a pandemic long before what was broadcast by the WHO. The WHO called it a public health emergency of international concern on the 30th of January, but it became called a pandemic in March only because nations around the world were not paying attention and following that reality.
Thank you, Dr. Marty. And what are pandemics rare? We always hear that the last pandemics were many, many years ago. Are they rare, and why?
Actually, Dr. Roldan, pandemics happen all the time in different types of species. This time, unfortunately, it's the human species that's suffering most severely from this particular virus, although it's actually infected many, many, many different types of animals as well.
Thank you, Dr. Marty. I also would like to tell the participants that we will be finished with our discussion a few minutes early, and that you all have an opportunity to ask in the Q&A questions to our panelists this morning. Dr. Trepka, what is the current situation worldwide with respect to COVID-19, and how is that compared to other countries?
Well, good morning. As you already mentioned, we have had probably more than 100 million cases worldwide. If I could have my first slide here. So this slide is showing the incidence rate over a week's period of time recently. This is as of January 27th. This is just to show kind of what the current situation is, where the countries that have the lighter beige colored have the lower rates. The countries that are in the darker reddish maroon colors have the higher rates. So I think the first thing to note is that the pandemic is pretty much everywhere around the world. That's the first point. The second point is that there are countries that have been particularly burdened and are currently have very high rates with respect to COVID-19. And that is in particular the United States. The United States leads the country leads the world in terms of the number of cumulative cases and also deaths. But really the entire Americas right now is affected, as well as Europe and the Russian Federation and South Africa have very high rates right now. So if we can go to the next slide. So this slide shows the cumulative number of cases over time, and the different colors on the bars represent different regions of the world, with the Americas being the gold bars. And again, the Americas, as you can see throughout this pandemic, have been heavily affected, as has primarily Europe, so in kind of the turquoise color. Now, when we talk about numbers of cases, I mean, we can only count cases if we diagnose cases. And the fact of the matter is that countries that are wealthier are more able to pay for testing, and thus it is likely that we are, the data is somewhat biased in that the wealthier countries are more likely to be able to make the diagnosis because they have more testing resources available than do poorer countries. So you need to keep that in mind. But despite that, we see that throughout the Americas, we've had very high rates. Now, if we can go to the next slide. This is, so cases I told you is that we can have bias with respect to that because of testing. And also, I mean, there can be problems with undercounting deaths as well. Nevertheless, it's very clear that deaths are occurring throughout the world, and these colors represent rates of cumulative COVID-19 deaths per million people. Again, the United States leads the world in this, but the entire Americas are heavily affected, and also, of course, Europe and the Russian Federation as well. So I guess the take-home lesson is that COVID-19 is essentially everywhere in the world, pretty much. But there are countries that are more affected than others. And I think for us living in the United States, not only are we heavily affected, but also our neighbors are heavily affected as well throughout the Americas.
Thank you, Dr. Trepka. Dr. Holder, you have spent your career in serving the underserved population. What are the underlying factors leading to the disparities that are seen in coronavirus infection and death in our communities?
Good morning, and thank you for having me. Coronavirus is one of these infections that has really shown us what we've known about health and illness and death for a long time. That we know definitely that where you live, where you grow, where you love, where you go to school, churches, play, your access to money and power, which drives the policies under which we live, determines a lot of your health. And so we know that in the US, we'd say the zip code you live in help determine it, and the policies under which we live. So when Dr. Trepka showed all that map, if you could show my first slide. What we talk about is the social determinants of health. So we look at that, your genetics, your biology, your environment, the care you receive isn't as major as all the socioeconomic factors. Now, what coronavirus showed us is that countries which had policies which did not truly embrace all the science would be impacted greatly in its response to coronavirus. So we look at places like Brazil and the US with high rates of infection, and especially in the US, despite its wealth, have greater infections. But then you look at age, so a lot of the countries that have a lot of death have a lot of older populations, while some of the younger countries like in Africa and parts which younger populations don't do as well. So we have both reasons that death and illness happens, but in general, the wealthier you are, the healthier you are. So in the US, the communities that have weathered the most and have shown the death rates 2 times higher, 3 times higher, like Black and brown communities, live in conditions in which this virus could be easily spread. multi-generational homes. They work out in public. They're in the face of coronavirus daily. And I know every weekend I am talking with a family or friends who have undergone this because many of the poorer communities are getting more infected because of where they live and they work and they have to survive, and then they bring it home. So we see that worldwide. And if your policies do not drive the support and the protection, you see this infection incredibly deadly in the most vulnerable populations.
Thank you, Dr. Holder. Dr. Marty, as we're talking about special populations, there's been a lot of concern with our children. Can you expand how safe are children and how safe are schools in this COVID-19 pandemic? We always hear of the elderly and the vulnerable populations, yet the parents are very, very concerned with this pandemic with their children. Can you expand on that, please?
Thank you, Dr. Roldan. Well, talking about children, so individuals less than 18 years of age, they do have several things going on at the same time. They have a similar risk of acquiring the virus as adults. So they have a similar risk of having SARS-CoV-2, but they have a much lower rate of COVID-19 disease. So a much lower incidence of disease, much lower hospitalization, and much lower mortality than adults. That's not to say that we have not lost children tragically. In the state of Florida, we have lost about 9 children, but that, relatively speaking, is a much lower number compared to the number of adults that we've lost. So the interesting thing about children is that while they're susceptible to SARS-CoV-2, they tend to have fewer respiratory symptoms than adults. The big problem with children has been this multi-system inflammatory disease, or Kawasaki-like illness, which is a complication that has a very varied clinical presentation. And Florida has had 110 of these cases in our state. We've had 108 in people under 18 and 2 in very young adults in their 20s. And going back to what Dr. Holder says, just as other things are a bigger hit on people who are Black and brown, this multi-system inflammatory disease is highest and disproportionately higher among Black and African American children and Hispanics. And we're still working on all of this. We need more studies in order to fully understand the role of children and teens in the whole transmission pathway of SARS-CoV-2 and the risk factors for severe illness.
Thank you, Dr. Marty. Now let's go into diagnostics. And as we know, we have done health in general, and the world of medicine has done quite a bit in the field of diagnostic and therapeutics and vaccine in a very, very short amount of time. So Dr. Trepka, as someone who is an epidemiologist and focused on public health, can you expand on measures of public health that initially has helped us basically face the impact of COVID-19 pandemic prior to having diagnostics and therapeutics available as the pandemic hit countries around the world?
So the very simple but difficult public health measures of physical distancing, wearing masks, avoiding large crowds, people staying home when they're ill, have all been highly effective at controlling COVID-19. The problem is that, one, it's hard to maintain these over a long period of time, especially the physical distancing. It has led to economic problems, for example, in the hospitality industry. It's also been hard to get people to cooperate with these measures as well. I think one of the big problems we've had is lack of consistent messaging about control measures. Now, if you think about any type of human behavior, it's very difficult to change human behavior. So it took decades to get society to change our attitudes about tobacco use. I mean, literally decades. The same thing is true about seatbelts. So it's hard to get people to cooperate with public health messages. When at the same time you have political leaders giving out different information or taking stands against some of these measures, that has led to a lot of confusion among people, has really impeded our ability to control COVID-19, and I think is partially responsible why we have had such a hard time with controlling the pandemic. Going forward, we have to have consistent messages about continuing these measures. The vaccines are here. We're so fortunate to have these highly efficacious vaccines that are rolling out now, and hopefully, by the end of the year, will be available to the vast majority of Americans. But that's not going to be enough. We have to keep doing the same measures, the mask wearing, the physical distancing, until we get control over the virus. So these are kind of basic things, but they're absolutely critical. Having technology therapeutics is so important. Having good testing, surveillance is also very important. Every piece is important, but a key piece is getting the population in general to get on the same page so we can get control of the pandemic.
It's really so important for our communities. We talk about vulnerable communities and Black and Brown people, but the reality is if we didn't come together as all of us in protecting each of us, it's not going to work, because many of the communities that I work in, they don't have a choice. They are the grocery workers, they're the healthcare workers, they're the home health aides, they're the lower level, low paid who must work and we call them now essential workers. But then they're faced with people who are affected by these mixed messages, who have not adopted all the public health measures, and then they take it home to their older people in the homes, and then that drives the infection and drives the death. So it's so important that it's beyond testing. It is really us as a community coming together to make sure that we protect the folks who really have no choice but to work.
Yes, Dr. Holder, you bring up an excellent point, and we all know that in those specific groups, there's a lot of mixed messages, and then there's the cultural barrier at times. Can you expand on how best we can educate and really spread the evidence-based measures for that population to follow and obviously keep them safe? Can you expand several measures? And I know that you have worked very closely with that population.
Yeah, and the interesting, the population, everyone thinks it's just Black people, but the data shows that it's also Hispanics and many people who are not readily accessing healthcare. They don't have primary cares because of lack of health insurance. And when they do access care, they may not receive the best quality care and the best treatment. And then you have the historical factors, where in the Black communities, you can go back to Tuskegee, where people were left untreated and given a disease, or you take into the Hispanic communities, where in the 1940s, there are also incidences of deliberately infecting different groups of people through sex workers, or in the 1950s in the Hispanic community, where some of the women were unnecessarily subjected to hysterectomies. So the health systems in both Black and Brown communities have a historical effect of having some distrust. So the only way to do it is to build back and express understanding of how this happened, and then provide the education. But the education has to be based on facts. We have social media now, so we're up against a bigger target, because now the WhatsApp groups will send more information out rapidly, or I should say misinformation out rapidly to all the communities. And then that comes against what the medical community wants to do. So I think we have a lot of influencers that we can use. We can use our doctors. We can use all the people that look like others to tell the other message, but express it with compassion and understanding that this didn't happen overnight, this distrust, and we know we're not going to get rid of it overnight, but there are ways. We've done a big effort in the churches. We just did 30 churches and we did 3 months of education. And that has I've really brought more people in to want to get tested. And we brought testing to the churches. We're doing vaccines to the churches, to the community, and looking at all the different barriers that are out there why people won't get infected. But it comes down with education, and it comes down with when you go out to meet your essential worker, you're out and you are wearing your mask and you're demonstrating it, that goes a long way to educate everyone that these things work. So it's all of us really putting the pressure and following the guidelines. That's really going to be the biggest factor. And bringing the care, bringing the testing, bringing the vaccines to the community.
Excellent,
Dr. I
excellent
have
points.
watched you-
Dr. Marty, I was going to ask you now. I'm actually looking at you to give us a very good summary of the different tests that it's out there. And obviously kind of going through the myth of what is a good test, what's a bad test, what is a test being, and then we will go into the topic of vaccines. So the floor is yours, Dr. Marty.
Thank you so much, Dr. Roldan. First, I just wanted to comment that I've watched Dr. Holder do her thing, and I've watched these church groups go from not being ready to take the vaccine or what have you, and then being very ready because of the beautiful way in which Dr. Holder presents the information. And that is absolutely critical to provide that information to a community. In terms of how we do the testings, there are tests that detect the virus, and there are tests that detect our response to the virus. That's the basic fundamental two different categories. In terms of the tests that detect the virus, there are very sensitive tests, and those are molecular tests. You keep hearing about RT-PCR, that's the gold standard that we're using. And then there are antigen tests, which look for a protein of the virus. Those have to be less sensitive because we can't amplify those. The other category is the looking for our response to the virus, and those are antibody tests, very different from an antigen test. And those, there are many different types of antibody tests. Some are better, some are less good. And among the antibody tests, very few are neutralizing antibody tests that really tell us whether the antibodies we have are of any good use or not. And this becomes really important when we start thinking about the problem that we have with variants in the world right now. In particular, we're very concerned about whether or not some of those antibody tests are going to be detecting people who are recently exposed to one of the new variants. And there are many reasons behind that as well. Would you like some more detail on tests? Or is that
Absolutely, absolutely. And then we'll go on to the topic of vaccines that I would like to ask Dr. Trepka to discuss a bit of why we vaccinate, but continue, Dr. Marty, so that we can expand on the different testing, because there's a lot of confusion out there. I'm a positive antibody. That means I'm safe and I will not get a coronavirus. So expand on that, please.
So that's a really good point, Dr. Roldan. For example, we look at these antibody tests, and in particular, we look at people who have already recovered from COVID-19 that have developed antibodies, and we tried those, they're neutralizing antibodies against the South African variant and the Brazil variant, and they mostly do not work. So 9 out of 10 times they do not work, which means that people who've had COVID and now get exposed to either the South African or the Brazil variant have a very high probability of getting sick again. And that's an important consideration. Another thing to think about with the tests that detect the virus itself, we are right now normally checking to see whether or not you have two very specific parts of the virus when we do an RT-PCR. And that doesn't tell us whether or not you have the variant. Very much more difficult tests, the sequencing has to be done to find out whether someone has a variant. So detecting variant in our community is not easy.
Thank
Could I
you.
ask a question about testing that I get repeatedly when I'm out there, because I go out every weekend in the community? Do I have to take the one in the nose? Can I take another one? They're so afraid of the one in the nose. What can I help them with?
So We're working on that right now at our laboratory at FIU because there is a lot of data from other labs suggesting that a sample from the mouth might be just as good as a sample from the nose. And once we do our validation, if we can show that that's true, then I think that people can get tested from the mouth, and that's a lot more comfortable.
Absolutely, higher compliance. Dr. Trepka, you talk to us about the importance of vaccination and why. And then we'll go into the efficacy, because we know that something being effective and what level of effectiveness the population is looking for.
Well, we're so fortunate that we have several vaccines that are highly efficacious. So it truly is a miracle if you think about it, that in such a short period of time that we have multiple vaccines that are highly efficacious. Now, the vaccines were tested against clinical illness. And so what these vaccines are very good at doing is preventing death and preventing clinical illness. We don't have evidence yet about how good they are at preventing infectiousness. And because of that, it's going to continue to be extremely important that people can continue those basic measures of the physical distancing and wearing masks even after they have been vaccinated. We anticipate that there is going to be, it will have some effect on infectiousness, but we don't have those data yet. So again, it's extremely important that people follow those measures afterwards. We're not going to, in terms of what things are going to look like once we can get the vast majority of people vaccinated, what we're going to see over the next couple months, I think, is we're going to see a decrease in the numbers of deaths, because we are vaccinating primarily older people, and those are the people most likely to die. So that is a good thing. So we'll see fewer deaths and we'll see fewer hospitalizations. And so the healthcare system is also going to be in a better position going forward. But we will probably continue to see a lot of transmission for a long period of time, unless people can be more compliant in terms of the basic prevention measures that I've already talked about.
Absolutely.
Dr. Marty, if you want to talk a little bit more about the issue of infectiousness, because that's really kind of the crux of the matter with the vaccine, or the big question, I think.
So would you like me to share my slides?
Absolutely. Let's
Okay.
just, if we could have Dr. Marty's slides, please.
Okay, so first let's talk about infectiousness of viruses in general. If a virus is too infectious and everyone is laid out and on their bed, then they're very unlikely to spread. Next, click. Let's compare some of the various coronaviruses. The original SARS coronavirus that we had back in 2003, 2004, which caused about $1 billion in expense, but it only, click again, please. Okay, so the grand total of people that were affected were just over 8,000, with 744 people dead, which seems like very little now. And then in 2012, click, you see that we had MERS. MERS came out in 2012 and it had a very high mortality rate. And we're still seeing cases of MERS. But with this very, very high mortality rate, click, even from then, we've had just over 2,400 cases. And although the death rate is high, it's not spreading. Click again. Look what's happening with this particular virus. Click one more time. And you can appreciate that with a lower percent mortality, you actually end up with a lot more people dead. And that is a very serious situation. And this is one of the things that it's hard for people to grasp how important it is. But the truth is, if a virus is too deadly, then it's less likely to spread. But if it's significantly deadly enough, which this SARS-2 virus is, and it spreads like wildfire, you end up with 2.3 million dead like we have right now, and it can continue to get worse. Let me just show you a couple more things. Click, click, click through the slides. This is one of the reasons that I think it's so important to do what Dr. Trepka, Dr. Holder, and Dr. Roldan have been saying, of taking those public health measures to lower our risk of exposure. Because if you get a low dose exposure, click, 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 your body can handle it. You're facing a much lower threat. Click again. But if you get confronted by a much higher dose, that's like having a huge army confronting you at the same time, in which case you are much more likely to have a much worse outcome. Click, 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 click. This is why we want you to use masks. Now, if you look at this, this is what we call the Swiss cheese model. You see that everything we do, even the vaccines, have holes. But as you layer your protections, you are much less likely to be exposed to any virus. And even if you are exposed, it's going to be that low dose that's so much less threatening to your entire system. And we do have some pretty good vaccines. We can stop the slides now. We do have some pretty good vaccines that are in production, as well as 2 excellent vaccines that we're using in the United States right now. And just like for the flu, any vaccine that has good efficacy at keeping us from getting ill is better than no vaccine. Although, of course, it would be best to have the best vaccine for every single one of us.
You know, that's so great with the Swiss cheese model. And that's why in the vulnerable populations, you mentioned, Dr. Trepka mentioned that age mattered and the older people were dying. But there's another huge group that we're seeing, people who have comorbid conditions. And we talked about who has more diabetes, who has more obesity, who has more high blood pressure, who has more of these conditions that make you die younger. And that's where we see in the Black and brown people, that death rate is impacting not just 65 and older, but younger. So when we talk about policies, and we're only giving it now to 65 and older, we hope the death rate declines, but it will decline in some people and some populations, but may not decline in as many. I just talked to a family whose the daughter was in her 30s, but she had morbid obesity and problems, and she was not 65 and she still died. So we don't want to think that it's only the older people are dying, but these other disparities in health affects that. So it's so important that we protect everyone from getting infected, because the vaccine is not out there for everyone who's vulnerable of dying.
And Dr. Holder,
right,
you
Dr.
bring up,
Holder.
yes, Dr. Marty, yes?
I'm sorry.
I'm sorry.
It's just that I get so excited, especially when Dr. Holder makes such an important point. And it's that important point that we have this reality that people of color and have a higher risk of all these underlying conditions. And therefore, that's part of what's contributing to their having a worse outcome from these COVID infections. And that's true for children as well.
Yes, absolutely. Dr. Holder, can you expand, because we do have some challenges, as you know, different states, they have executive orders, et cetera. And we understand, as you just alluded to, that there's certain populations that currently, have not, are not getting the vaccine. Can you expand what would be a roadmap for us to be able to work through those constraints?
God, the best roadmap would have been to us understanding these issues and implementing it as we roll out policies. Because we absolutely know that there are certain barriers in certain populations. Just transportation is a big barrier, education, the digital divide, and that impacted Black, brown, anybody, elderly in getting access to these vaccines. So rollout would best be structural issues where we take these barriers, we think about it and say, how best do we meet the needs of each population, especially those who are incredibly vulnerable of dying. I think of the 65 and older. I know everybody who had a grandparent there has been working to get your grandparents on the line. So I think we've seen so much evidence where inequities in decision making, when you don't look at the structure that you're using a process to deliver care of any sort, will impact the outcome. We also see, like in Palm Beach County, they chose the single provider of vaccines to be a supermarket that for its history, has never been in poor communities. So big communities like Belglade, which is in Palm Beach County, has no public supermarket. So now there's a scramble. How do we change these decisions? So policy, again, the policies under which you live drive so much of what happens. So what's best? I say it's get the people who do this work at the decision making so this can be built into these decisions. And there are a lot of folks who know this information, but how do we get the people in power to listen to some of these decisions and think that it is not being unfair to find the groups and provide the services? So some group may need mobile units, some group may need a telephone bank to make the information, like the elderly, rather than asking them to depend on a internet system. I mean, Jackson was putting on Twitter when their lines were opened up. Now, my mother was 92, cannot do Twitter, doesn't even know what Twitter is. So there's no way she would have known when Jackson opened up their vaccine sites. So there are many things that we already know. Dr. Trepka, as the public health schools all over, could have given a lot of guidance. So I think it's as far as society to come to terms with the science, respecting the knowledge, and using all our years of information to devise a system that really equitable. I have a slide that talks about, if you could show it, because this slide explains what we're talking about in medicine and in the world in public health, what equity means, that is not taking from somebody and giving it to someone else. It is really taking the barriers away that the most vulnerable people of death and dying and the folks who could pass this infection on get the first access to controlling the disease. Because as we know, here we go. If we just put out the same treatment for everyone, which is what the vaccines were rolled out, 65 and old, everybody go get it. It left a lot of elderly people, the people in wheelchairs, the people who couldn't have access to that system, not getting it. So when we move ahead, where we look at, and now where we are is where we're now having these pop-up sites as to remedy the mistake that was made at the beginning. So we're having all these pop-ups in little churches and pop-ups in big centers, like I think Hard Rock, they're starting them in Marlin Park, but I look at this as a pop-up way. The way we really want is where we look at the strategies, we bring in the science, we bring in the data, and we come up with a system that addresses all the barriers to make sure that the most vulnerable folks who are going to die, who are going to pass this on, get the vaccine, get ready access to care, and understand that mask, distancing, hand washing works as well as anything till we can get that really good treatment. So this is our issue in making that change in our societies. And this is worldwide. This is not just the US. We're seeing the same factors across the world in how care is delivered. Right now, we're seeing the European nation, luckily they stopped it. They had blocked the delivery of the vaccines, which would have affected poorer countries.
Correct.
So we know that these issues have to be addressed worldwide when we look at equity, and we have to put equity as the underlying factor because that's what saves lives worldwide and will control the infection worldwide.
Excellent points. Dr. Trepka, one of the things we always hear now is with the vaccines being here, and as you alluded to, we have more vaccines coming forth. Everyone wants to know, moving forward, when will we return to normal? When can we hug again? When can we live our lives again? When can we travel without having to read what the next travel advisory is, or for that matter, landing and having to be quarantined in a hospital? What are your thoughts on that?
Well, our county government talks about moving to the new normal. That's what's been used throughout the year. Honestly, I think going forward, we are going to have a new normal. We're going to be living with this virus for years. We're not going to be eradicating this virus. We've only eradicated one disease, namely smallpox. So we're going to be living with the SARS-CoV-2 virus. The question is, how fast can we get control over it and how fast can we get people vaccinated so at least it's not so deadly? and it will result in so many long-term health problems. So I think that's what we're moving towards. Are we going to be able to go so when is that going to happen? I think it depends on several factors. One is, how well are we going to be able to keep rates controlled such that we don't have new variants arising, or lots of new variants arising, and variants that our vaccines are not efficacious in protecting us from. Okay, so that the variants are one thing. The other thing is, how quickly can we get the vaccine out? How we can manufacture it and distribute it. It's extremely important that this happen as soon as possible. It's extremely important that we get the clinical trials done in children so they also can be vaccinated, because we can't get to herd immunity without including children. And then there's also the big question, there's a clamor for vaccination now. There's a lot of people that want the vaccine, right? And then there's a group of people that say, I'm not so sure, I want to wait it out. And they'll probably wait it out a few months. And once they see that their friends and their neighbors are doing okay with the vaccine, they'll get it. And then we'll have probably a group of people that will refuse to get the vaccine. I say that because we've seen that with other diseases, for example, with the childhood vaccination efforts against measles. How large will that group be? That's going to be a particularly big challenge for public health, to try to keep that group as small as possible, because the larger that group is, the more likely we're going to have reoccurring outbreaks. And then finally, the other factor is how fast can we get the rest of the world vaccinated? And it's highly critical. We've all seen now the entire world is affected by this. We are not an island in this country. As long as coronavirus is circulating around the world, we'll continue to be affected by it. So that's a lot of unknowns. But I think, in the near term, I think we'll start to see fewer deaths, because the high risk people in terms of age are being vaccinated. That means that the deaths that we are going to be seeing are going to be among younger people. Just simply because, relatively speaking, they'll make up a higher proportion of people who are severely ill. So, and then, maybe we can get the vast majority of people vaccinated in the United States by the fall, and things will start to look normal, but probably it won't be the way it was. We won't have 2019 completely in the next few years. And I don't know how the rest of you feel about that. If you're
Absolutely. Well, I'll open it up to the panelists, and then I'm going to subsequently ask what we are to expect. So, Dr. Marty, any comments on expanding what Dr. Trepka just mentioned on getting back to that new normal that we knew prior to December 2019?
So I think Dr. Trepka provided a brilliant overview of what's going on. The bottom line is, we have to get ahead of the virus. Right now, the virus is going to do everything it can to continue to spread, and it's doing that. We're seeing that with the variants that have formed in the UK and South Africa and Mexico and Brazil and California. It wants to get ahead. We need to be ahead of the virus. We now have these phenomenal new tools, these vaccines. They have incredible efficacy. Yes, it is true that both the Pfizer and the Moderna vaccine are not quite at that near 95% level when it comes to some of these variants, but they are still effective at preventing serious illness, even from people who acquire the South African or the Brazil variant. So they are still better protection than not having them. And yes, we are working on producing slight modifications to the code of those vaccines. Moderna has already started. Pfizer is planning to start in the near future to capture those changes. In the meantime, it is absolutely critical that we just bear with it and use the public health measures, use that the Swiss cheese approach to keep ourselves ahead of the virus so that we can get there sooner, so that we can have the people vaccinated and our population at a much more normal condition. And I think we can do it if we do exactly what Dr. Holder, Dr. Trepka, and Dr. Roldan have said, which is we have to do it together.
Absolutely. This is a collective action, so to speak. Before I turn into, we have a few questions from the participants. I would like to kind of end this discussion on opening it up to what I feel, and I believe that you all feel the same way. What would be the next pandemic? And that is the delay of healthcare, access, and also mental health. So if I could just get very brief overview or very brief comments from the three of you, what do you think we will be faced even post-COVID pandemic?
Well, one thing that we're already facing post-COVID are the long haulers. That's a serious consideration. We're seeing more and more individuals who continue to have symptoms because they had COVID-19. And that in and of itself is a sizable number of people, which will only continue to grow if we don't do what we said earlier and get a hold and get ahead of the virus.
Dr. Trepka, your thoughts, and then Dr. Holder, please.
So I think we're going to be seeing the health effects of this pandemic for decades, probably for a couple generations. And I say that because it's not just the virus itself that is causing harm. It is, the virus has caused economic disparities to increase. It's caused educational disparities to increase, such that we're going to see, I think, if we do something as a country, we're going to see increased size in the inequities that we have in terms of both socioeconomic status and also educational status. As Dr. Holder showed, those factors are the strongest factors for almost all health conditions that we deal with. So I anticipate we're going to be measuring the effects of this pandemic really for decades to come.
Absolutely. Dr. Holder, your comment?
Dr. Trepka said it, I don't even know if we'd call it a next pandemic. It's the ongoing pandemic of inequities that has been driving who dies and who lives. And we will protect the 65 and older, but for the folks who are, when we say younger, we're not talking about 10-year-olds and 20 and 30-year-olds. We're talking about 50s. We're talking about obese people and diabetic people. So we already see signs that the next big death continuing worsening will be in that population if we don't protect each other. So the ongoing pandemic of inequities and disparities in care and lack of health care, which will set the stage for climate change, which is now coming. And so you put this on one big storm that could come the next hurricane season, where are we? So the continuing pandemic of inequities, which must be addressed if we're going to save lives worldwide.
All great comments. Dear colleagues, thank you. Thank you so much for this wonderful discussion. We do have some questions from our participants. Unfortunately, we have just a few minutes, so I am going to pick and choose, and this is totally at random. So first question is, had the health messaging in the US been more consistent from the beginning of the pandemic, how much less severe could COVID-19 be in the US now? Anyone?
There's no question that with better messaging, we would be in a much better state. And the evidence for that is very clear if you go around the world and you look at what different leaders did throughout the world. Messaging is absolutely critical. If I can just 1 minute go back to the comments by Dr. Holder and Dr. Trepka. When Dr. Trepka said that we're going to have this for a long time, it's absolutely historically accurate that that has happened in the past. Many other types of pandemics that we've seen have exactly that kind of pattern. Even the influenza pandemic had long-term consequences, and those were not, and that was not as bad as this has been. So, yeah.
Dr. Trepka, Dr. Holder, would you like to make comments on that?
I mean, you can look around the world. New Zealand had better messaging, had better transmission. The Caribbean, Jamaica, much of the Caribbean has done better because there was consistent messaging, consistent adherence with the public health. So poorer countries, richer countries, it's clear that consistent messaging using I mean, it's common sense. I don't know, my grandmother would have told me, everybody knows cover your mouth and cover your nose. So To have had it been assaulted like it was, we know we would have saved lives, especially poorer people who have to work.
Absolutely. I have a very interesting question. Congressman Lynch of Massachusetts just tested positive for the virus, even though he already had both doses of the vaccine. How frequent is this, and can this be avoided? Dr. Trepka, would you like to take that one, please?
Maybe I'll let Dr. Marty handle it because she's ready to
Dr.
speak.
Marty? Sure.
Thank you. So even in the vaccine trials, we knew that a percentage of people were getting COVID, and a very few percent of the people who got COVID who were fully vaccinated had severe disease. In fact, that's where we get our 95 and 94.1% efficacy, because some people do still get COVID. And that goes back to what we talked about earlier, which is the dose. The dose makes the poison. Even if you're fully vaccinated and have time, if you then get exposed to a large bolus, you can get, any protection can be overwhelmed. But that doesn't mean the vaccine's not working. It simply means we still have to take precautions until such time as the entire viral load throughout the community is way down.
Absolutely. This is a question also, Dr. Marty, secondary to that, is everyone is concerned, you kind of alluded to in your discussion, but everyone is concerned with the new variants. And they're saying, well, all these vaccines were actually developed when we only knew what COVID was, right? Now we have all these variants from around the world. How can you give, the support or the public trust that these vaccines can actually help against the new variants?
Well, that's exactly what everyone started to try and figure out. Will they work against the new variants? So both Moderna and Pfizer conducted studies with the UK variant and found that both of their products were very effective still, very high level of efficacy in the lab, because it obviously hasn't been enough time to test it in humans that way, but in the lab, equally effective for the UK variant. But when it came to the South African variant and the Brazil variant, those it doesn't quite get to that 95% efficacy. In fact, it's 6-fold less for the South African variant. And that's why both Moderna and Pfizer are now in the process of adding a little bit of extra code that they can then add to the vaccine so that we can cover those to the same level. But you have to remember the most important message is that they are still effective. It just doesn't get you to that 95% level. So you are still more protected having the original vaccines than not having the vaccines. And eventually those who have already received 2 doses of the original version can get a booster that will cover the new variants. But it's precisely because these new variants can form, and precisely because of the challenge of making new vaccines, that it's absolutely important that we get as many people vaccinated as possible the soonest that we can, and that we continue following the other public health measures so that we don't give an opportunity for the virus to form an even worse variant. Because every time the virus transmits from one person to another is an opportunity for that variant to form, for a new variant to form that can be worse and can be more challenging. And even right now, the variants that we're looking at difficulties with some of the best treatment modalities that we've developed, which are the monoclonal antibodies. So again, we're trying to tweak those monoclonal antibodies to be able to manage the new variants. Let's try not to make new variants.
Absolutely. Great points, great comments. And I keep seeing great questions coming forward from our participants. I will let you know that please, we will be responding to your questions. I wish we had more time to be able to address each and every one of them. They're all excellent questions. But at this time, I would like to come to closure of today's panel discussion. I want to thank my colleagues, Dr. Marty, Dr. Trepka, Dr. Holder. As I stated initially in the beginning of this panel, they're highly passionate individuals. great experts in their field, and I'm truly honored to work alongside with them as we battle and continue to face the challenges of COVID-19 pandemic. Also, I cannot be, I have to thank deeply the organizers of this excellent conference, because we are in an incredible company of global leaders that are there and are fighting each and every step of the way for the health and well-being of the population. And also, I also would like to be very appreciative and my gratitude to the generous support of the Green Family Foundation that has made this conference possible. So David, thank you so much for this wonderful opportunity to have our experts to be able to participate in this very important conference. And as I said, please send in your questions, and my colleagues and I will be very, very happy to respond to them. Thank you, and please stay safe.
Dr. Roldan, thank you so much, Dr. Trepka, Dr. Marty, Dr. Holder. What a fantastic panel, brilliant insights. We really are grateful. This was a fantastic way to kick this off. And so my sincere thanks to all four of you, because we know how busy you've been being on the front lines handling this pandemic, but then you really shown for us what FIU brings to the table. So thanks so much for taking the time to join us.
Our pleasure. Thank you, David.
Thank you.
We are going to take a 15-minute break and come back with the next panel, which will be, the title is also the title and theme of this conference, The Struggle for Democracy. We have a terrific panel joining us for that. So please stay tuned. You can continue on this link. You don't have to log off. The links won't change. And we will be doing a quick camera and mic check for the panelists as we approach the start at 11 a.m. Eastern time. Again, thanks to the first opening panel, terrific start, and we'll be back in 15 minutes. Thank you.
Thank you.
As a student who is interested in looking to go into politics in the future, having the experience of State of the World is one of the best things that we can get.
So at this event, we will see panelists throughout the 2 days from all walks of life. There are journalists, there are scholars, there are actual diplomats themselves, and they discuss prevalent issues to today's international communities.
Human trafficking is now part of the conversation. Our original response on the 29th of December to their rocket attacks on us on the 27th of December was absolutely justifiable and right under international law.
I don't think that if you talk to any Democrat, they would tell you that impeachment was good politics for them.
This is an experience that students don't get on a daily basis, because despite the fact that you can learn a lot in classes and in lectures, you can't experience having a real-life policymaker, a real-life scientist there in front of you, explaining to you the intricacies of these foreign situations and conflicts.
You've assembled such an amazing group of people here that it's become this sort of meeting place early in the new year. So it's to really become the first conference of the new year.
State of the World proves that every concept we learn in poli-sci courses, in international relations courses, in any one of those social sciences, how they are applicable to real day issues and events that we are seeing.
Hopefully when you leave here today, you'll be enabled to have an even louder voice than you already have.
I think you've really established something here at FIU that you should be very proud of.